There we go. Excellent. So there will be a recording of this event available afterwards, and I will send you a sort of invite if you want to. I'm just charging £9.50. Just it just covers expenses really, but you're very welcome to that if you'd like to replay the event. It's very exciting to present something on this subject because it touches so many people, so many families, so many people. The number of children with these conditions, if you'd like to call it that, are is astronomical now, and it doesn't just affect the child or the person themselves with this condition, but it affects the whole family. And it's why I got interested in working with these kind of cases because I knew I could make a difference, hopefully, anyway, to the whole family. So today we're going to start off by we'll look at some definitions of we understand what these issues actually are and how they present. Then I'll present also some cases, and we'll also I'd like to invite you to submit your questions. Hopefully, I can give some reasonable answers, and you can. There's a chat box, and you can put your questions there, or you can unmute yourself. And I've allowed you to unmute yourself, and you can ask me in person. And if you want to put your where you're based in the chat box, it's really nice to just know. It's not for any reason other than it's just nice to know who's here really. So um, let's press on. So I wanted to introduce this with a description of my first autism case, which came in a very unexpected way. Basically, I was living in Brighton in the UK. I still am living in Brighton, but I was living in another in a flat, and a woman and her son moved into the upstairs flat, and she was very friendly. But as soon as I saw the son, I knew there was something not quite right. He stood very stiff in the hallway, and if I asked him a question, he would just answer with one-word answers. And I know, I mean, that can be a characteristic of a lot of teenagers. He was about 17. I've called him Daniel. That's not his real name. And so I knew something was wrong, and I asked the mum about him, and she said, well, he's autistic, and she fully expected him to spend the rest of his life with her. She prepared herself for that. And I asked her if she would like, I introduced myself. I said I'm a homeopath, and would she like me to give him a remedy just to see if something could help, maybe? Now, she knew nothing about homeopathy and was a little bit skeptical and just said, okay, if whatever, go for it. So I gave him a remedy. It's a remedy called Barita carbonicum. It's that's the Latin for barium carbonate. It's a well-known remedy. It's probably the first remedy we reach for in these kind of cases, in autistic cases, where there's a developmental delay. And yeah, you can see the description. He had no ambitions. He lived with her. He couldn't go to school or college. He was very bright, but basically he had a stunted life development. And it has started as a symptom when his father left the family. They divorced, the mum and the dad divorced, and that sent him into a kind of shock. And the amazing thing, so Burita Carbonicum, one dose, and I remember talking to the mum, and she said, "Well, he got very, very angry after the remedy, and that's often a good sign when there's something basically stored up, energy stored up, and it's just put the whole system into shutdown." He got very, very angry, and after that, things started changing. He when he decided to go to college, he got a sort of part-time job. And then as time went on, I mean, he basically normalized. I mean, he got a girlfriend, and as far as I know, he's living just a normal life. And he's obviously not living with his mum anymore. And his mum, now, interestingly, Daniel was very skeptical and said that he didn't think the remedy had done anything. And the mum said, no, this remedy has caused a massive change in this boy. And she was forever sort of thankful and was a complete convert to homeopathy after that. She became, yeah, very alternative minded. Now, if you could just turn off your microphones, if you've not, unless you're actually saying something, if you could turn off your video and turn off your microphone, that would be helpful. I can see a couple of you got your mics still on. I'll try and let's see. I'm going to mute you. Mute. Okay. But if you want to say something, please do. I do welcome questions. So that was my first introduction uh, to autism as a thing, and was very encouraging, obviously. Let's have a look at this is quite interesting. I thought I'd prepare a chart showing this is autism rates over the last 30 years. So in 2000, 1 in 150 children were diagnosed with autism. In 2018, it became 1 in 44. In 2022, 1 in 31. This is in the US, by the way, but would be reflected, I think, elsewhere as well. In 2010, 1 in 68. And in 2020, 1 in 36 children have been diagnosed officially with autism. Now, just to put this in context, yes, there have been uh, kind of developments in the way we diagnose, and perhaps it's been recognized more than it used to be. And so that would account, I think, for some of the increase in diagnosed cases, but it doesn't account for all of them, for sure. And so it's an interesting question of why this has happened, of course, and it's quite a controversial subject, which we might touch on. So let's have a look at what is autism. Um, it's called a spectrum because children can be highly verbal or minimally verbal. Some can be just absolutely mute, so not talking at all, socially outgoing or socially withdrawn, intellectually advanced or developmentally delayed. And some features include things like sensitivity to sound, touch, food, and clothing. This is a very particular thing, is a need for routine and predictability. If you've got a child who's autistic, you will know that they don't like any changes to their routine, and it will send them into a flare if that happens. Difficulties with social communication often, so they kind of sort of often cut off. There's not a a connection, really, a real connection with other people, often. Repetitive behaviors or intense interests. So like stimming, sort of moving of the hands, automatic movements of the arms and the hands, as is quite common. Emotional overwhelm or sort of shutdown. But it's important to realize that many autistic children are highly sensitive, intelligent, and perceptive. They can have a focus on. They can be very bright in one particular area. That's quite a common thing. And some autistic children are very. I mean, if you saw Rain Man, that film, how many years ago it was, where they can have a particular, for example, a focus on mathematics and are very bright at that, but nothing else. Okay, so that's sort of autism in a nutshell. Let's have a look at ADHD, which of course is, I mean, so we talked about the number of children who are now diagnosed as autistic, but that doesn't even include all the children with ADHD and OCD and PANDAS. So it really is, and it's a pandemic. One can rightly say it's a pandemic, and really governments have not got a handle on this at all. So ADHD, a condition involving difficulty regulating attention, impulse, activity levels. It's not bad behavior. So children with ADHD can show difficulty sustaining attention, especially for boring tasks, impulsivity, acting before thinking, hyperactivity or inner restlessness, very emotionally reactive, and often poor sleep or difficulty winding down. So very sort of active brain. Some children appear constantly on the go. They can be easily distracted, so it can be very difficult at school, for example. Overwhelmed by demands, um, and others are dreamy, internally distracted, or mentally busy but outwardly quiet. They're often given, or they can be given, a conventional drug called Ritalin, um, but it's not a cure. It just puts a sort of plaster over things. In homeopathy, we're looking ideally for a cure. And now I'm not claiming cures for autism or ADHD, but I'm looking for something that is self-maintaining so that improvements are self-maintained without continuous or continual dosing with a supplement or a remedy. So a change, a shift in the behavior, a shift in the development is what I'm looking for. Okay. OCD. So this is very anxiety based. So as it says there, intrusive thoughts or obsessions and repetitive behaviors or mental rituals. So these are driven by fear or discomfort. In children, OCD may look like repeated checking, counting, washing, sort of intrusive thoughts about harm or danger. For example, fear of being poisoned, for example. And a case will present to you will demonstrate that quite well. Um, Rigid rules or rituals, distress if routines are interrupted. So there is some overlap here between autism, OCD, ADHD. There is some overlap. Let's see, somebody has put something there. 7 types of medication. Thank you. Yeah, 7 types of medication for ADHD. I'm not surprised. But Ritalin is the sort of main one, I would say, the most well-known one. When doing homeopathy, do we need to stop the supplements the kid is taking? No, you don't. You can continue giving the supplements, but you may find that they're not needed so much. With the homeopathy, it depends, and depends what supplements you mean, whether you're talking about conventional medication or just the vitamins and minerals. And certainly with vitamins and minerals, there's absolutely no harm at all. Um, so thanks for those questions. Keep them coming. Um, children with OCD often know the behavior doesn't make sense. That's the crazy thing, but they feel unable to stop. It's about control with anxiety. It's control, trying to control things when they're feeling very anxious and fearful. It's not really sort of stubbornness or attention seeking. It's more about the way they are responding to anxiety. Let's have a look at what pandas is. So pandas, it's apart from being an animal, a lovely cuddly animal, it stands for pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. It's an interesting one. Um, Pandas is a condition where an infection, often streptococcus, uh, triggers an immune response that affects the brain and nervous system. It's an interesting one, really, and is surprisingly common. It's symptoms can appear quite suddenly and dramatically. And again, there can be some overlap. It can look like, autism and pandas can look very similar, and OCD as well, and ADHD. Sudden OCD symptoms, severe anxiety or emotional volatility, some tics like sort of twitches, for example, or unusual movements, aggression or regression, sensory disturbances, sleep disruption. Often they often feel outside the group. So often at school, it can be very difficult. They can feel persecuted or rejected, and there's often a sort of great sense of hurt about that. So, all right, let's have a look. It depends how much support you have or resistance from others as to supplements. The easy first for those who prefer to blame the mother rather than allow homeopathy and other holism to resolve the case. Maybe this is different for others. This is how it was for us. Um, yeah, that's a whole basket of controversy, isn't it? It's about blame. I'm going to not really go into that too much. I really want to focus on what these conditions are and how homeopathy can make a difference. So, Down syndrome is actually a genetic condition. It's to do with an extra chromosome, and it does affect physical development, learning ability, so it can look superficially like autism, but the impact varies widely from person to person. So common features may include learning disability, uh, it can be mild to moderate, delayed speech and motor development, characteristic facial features, low muscle tone, an increased risk of certain medical conditions as well, such as heart defects, thyroid issues, and hearing problems. People with Down syndrome, they often show strong social engagement. There is often they can be quite clingy, or they are quite often very friendly to everyone, to strangers as well as family. Warmth and emotional sensitivity, and a clear individuality and personality. So it's subtly different from the other issues we've talked about. Um, and I'm treating a young lady with Down syndrome who's doing really well. Um, so I don't know whether I actually includes it in my cases, but it's improved. Before we started working with her, she was very introverted, didn't want to see friends, and uh, and through the homeopathy, she became much more sociable. Also, like she had a stutter or a stammer um, before treatment, and that went. Um, she became much more confident in herself. Before, she was very, very sort of like very dependent on the mother, and although there is some dependence still, she became much more, or more, she became more independent and became more confident in herself. So these are maybe subtle things, but they are so important, and can make a big difference. Even the small changes can make a big difference in the family's functioning. Okay. Asperger syndrome is is a sort of subset of autism. They tend to have but above average or above average intelligence. They often don't have any sort of language delay. They struggle. Oh, let's see. Um, they struggle with social understanding, and that's the thing. There's a sort of sense of They don't read the cues. They have difficulty reading social cues. It's one of the main features of Asperger's. They tend to think in a sort of literal way. So it's difficult. So that sort of thinking laterally, for example, is not, they often have difficulty with that. Or thinking sort of intuitively and emotionally. It tends to be quite literal. Intense or narrow interests. So again, they can be very, very talented at one particular thing, or some university professors have Asperger's syndrome, in fact. They're very, very intelligent, but they have difficulty with relating socially. Sensory sensitivities, anxiety, especially in social situations, and just feeling a bit different and out of sync with their peers. Okay, now I want to present a case. This is a real live case of a guy. I've now discharged him because he's effectively, I wouldn't say cured, but he's living a very full and rich life. And he's an interesting case because he started off as a girl uh, and is transitioning to being a male. And he was 23 when I started working with him, and he was on weekly testosterone injections. He was very, very anxious. It prevented him from going out alone, even to the shop. He had a strong preference for being at home. Um, his siblings, his siblings would go out, but he stayed in. These were sort of typical autistic features. Needed routine and predictability, and even small changes. For example, Starbucks changing their location was very unsettling. Marked anticipatory anxiety, worries, sort of anticipatory, thinking ahead of all the sort of things that might happen. So imagine scenarios. For example, when he gets to if he was driving, when he gets to the roundabout, the traffic intersection, and how will he react? Um, or meet if he meets somebody in at a doorway, how will he handle that? And just gets very easily overwhelmed. So this is all very typical autistic features. He was quite clingy, so very dependent on his parents. He slept in the parents' room, couldn't sleep alone. He clung to his parents, and he had been having some homeopathy. His mum actually is a homeopath, and she brought him to me to see whether I could, you know, I'm sort of known for thinking a little bit more outside the box than some other homeopaths, and so that's why she brought him to me. And so anxiety and depression have increased recently. He had started some time ago, he started escitalopram, which is an SSRI. It's like Prozac, and had some counselling. And the long-term aim is greater emotional stability and independence. And so the first remedy I gave him was the same remedy I gave to my neighbour's boy, and it was Burrito carbonicum, and started off with a 1M and then moved up to a 10M. Let's see what happened. So it was very, very noticeable improvement. He basically submitted his CV to a pet retail shop. So remember, he would not even consider getting a job. He was so introverted, so inside himself, so dependent on his parents. The thought of a job a job would be unthinkable. Yet after the remedy, he's put in a CV for the pet retail shop, for shelf stacking before opening hours, with no people around. His head feels calmer, not overthinking so much. He's able to pause and choose, for example, in a restaurant, thinking what he wants. When driving, intrusive thoughts he could be ignored rather than obeyed. So there's more control of his thoughts, clear description of controlling and safety thoughts. He still has hurry thoughts when shopping. He worries about pulling out his card out fast enough. So again, it's some anticipatory anxiety. He gets flustered easily. Thoughts of trying to keep him safe by staying home. He has a strong bond with animals. That's often quite common with autistic children or adults. Um, OCD features, change is difficult, especially when plans alter. And so that, but anyway, there was some improvement, and I was very, very pleased, and his parents were very pleased as well. Certainly, it had moved him on in his development. This is his mum's observations. The pregnancy was unplanned. Um, she says that her son has a sort of flat, sort of middle ground. The way he expresses himself is neither excited nor depressed nor sad. It's sort of very, very in the middle. Black and white thinking, rule following, doesn't want to be seen. Panic attacks are internalized, unclear sense of self or identity. And obviously, there is the aspect of the transitioning, which before I treated him, I thought maybe I would need to look at this aspect of his personality. But in fact, that was one thing which he didn't seem to be worried about, or the transitioning he seemed to be quite confident about. So I basically put that to one side. I mean, it did sort of informed, it gave me some background information about him, which was important in choosing remedies, but it wasn't in itself a problem for him. And his parents were very, very supportive of his changing of his gender. Okay. What does we do? Yeah. Oh, wait a minute. What have I? So I think as I let's see, I haven't put the other remedies on. Oh yes, right, okay. He's okay. This is after I think the 10M burrito carb. He's feeling lighter, more confident. Applied for 2 jobs. OCD noticeably reduced. Controlling thoughts much quieter. Less worried about what people think. Doing things more independently. For example, this was something quite the standout. He went into town alone and got an ear piercing without asking his family. Before, he would always check with his family everything to do anything. He would check with his family. But this was a completely new departure. He went into town alone and got an ear piercing without asking. And then he also went alone to a horse tack shop. Mother described this as very unusual. He's working in a grocery store now. He's doing well, stacking shelves. He's making aisles neat. He says the co-workers are nice. He's asked customers if they needed help. Again, the fact he could even approach people and ask them if they needed help shows how much his confidence was improving. He goes out alone. He doesn't stand next to his parents. He makes decisions without asking permission. He can pause before responding rather than reacting immediately. He wants to meet people and make friends. The OCD did stick. It was quite stubborn, really. These kind of intrusive thoughts did stick. He went to a Christmas party. He had great fun. I'm not sure whether I've got the remedy pros order correct here, but this is what happened over different remedies. Pretty good overall. We went to a Christmas party, had a great fun. Again, this was unheard of before treatment. Brother came to, chatted with everyone, felt confident, went to the Christmas market alone, would never have done this before. His parents were amazed. At work, he's more comfortable talking to people, proactive with customers, took on extra hours. Previously, he wanted to reduce them, but he actually felt so confident that he could took on extra hours. He answers call outs without worrying. Still some talking in his head, so he's still got that going on. The remedy I gave him at this stage is a fern called Hemionitis palmata. Then he had a bit of a kind of dip. He had a crisis of confidence. He took on a new job, so he took on new responsibilities, and it put him into a crisis of confidence. He felt overconscientious, worried about making mistakes, and this thing about the feeling that people think he's dumb. And the remedy is quite an unusual remedy. was lacosinum, which is ass's milk in a homeopathic preparation. It's not, we're not giving him a glass of milk. It's a preparation of lacosinum, of the ass's milk, so donkey's milk, effectively, which has this in its picture and its image of how we prescribe it. It has this idea of people thinking that I'm dumb and worry about making mistakes. And he did really well on this, really, really good. Took the remedy again, much calmer at work, feels lighter, more carefree, less afraid of receiving instructions, feeling ambitious. He actually signed up for a graphic design course. I mean, he basically started just living a completely normal life. He would go out with friends, he'd go on trips. He wasn't dependent on his parents anymore. He slept in his own room. And finally, the last remedy I gave him, he had a thing about guilt, about making mistakes, and there was a sort of slight OCD still there. And the remedy I gave him was called beryllium bromatum, so beryllium bromide, and that effectively took away all of that. All those internal dialogues in his head all went, and he was delighted. So I think that was it was such a heartwarming case. It really, this it showed what can be done for autistic children and adults as well. Now, causes and triggers. So, find my notes. So, autism is best understood as developmental vulnerability shaped by stressors acting on the nervous and immune system. So, some relevant factors. So, this could include a constitutional sensitivity, like an inherited neurodevelopmental traits, heightened reactivity of the nervous system. There could be pregnancy and birth factors. So, maternal stress, anxiety, illness, these can all have an effect on a baby's development. If the child is born premature, or if the labor is prolonged, or if there's separation at birth, or certain neonatal interventions, that can all have an effect on a child's development. Early infections, recurrent illnesses, and autoimmune patterns like PANDAS can all have an effect. Just need to move myself around here. Okay. But also we have to look at antibiotics. They can be a stressor, medication, other medications, some toxic exposures could be indicated. Um, Vaccinations, this is a very emotive and controversial subject, and I don't want to sort of put too much, I don't want to say too much about this, but vaccinations, they don't, I mean, they don't cause autism with everybody. I'm personally very, how will I put it, skeptical about vaccinations, and the downside of vaccination is not made clear enough, I think, to parents. They are promoted as being completely safe and effective, and this is certainly not the case. So in some children, they represent a significant immune and neurological stress. And immediately after, the number of patients I've had who the parents say they've observed sudden behavioural change after the vaccination, regression, onset of OCD, tics, anxiety. These are relevant events. It's not about beliefs, or it's not political. These are clinically relevant events. You cannot ignore that. And of course, that has an effect on the kind of remedies we choose as well. Yeah, thanks, Rebecca. Yes, we all know. I mean, anyone who keeps an open mind knows that it. I think the thing is, we know that vaccinations do have an effect on some children. I think the only question is how many. And the research that has been done is not very encouraging and shows that the in terms of children who've been vaccinated against children who've not been vaccinated, it looks like they can have quite a definite effect, a definite negative effect, not just in development either, in just general health. But anyway, I'm not going to sort of stay too long on that. Um, but it does affect how we treat the child as well. If they have responded to a vaccination, then it does have an effect on the sort of remedies we give as well. So this is how I approach autism homeopathically. I treat the child. It's always about treating the individual. It's not treating the diagnosis. So you're looking at developmental arrest, so that's sudden developmental stalling, shock, trauma, and nervous system overload. And it's all about the individual behavior. And it's important to say this, it's not even in the case I presented, you could see that there was a gradual improvement and certain things would improve and maybe there would be dips and so it's not always it's not like a silver bullet that's going to one tablet and they're going to be cured. It's not always like that. Unfortunately, it can take time. And I worked with that young man over, I think it was a period of it was about a year, something like that. But it's all worthwhile stuff. It's all worth doing. Okay. So what does it look like? What when you've had homeopathic treatment, what does it look like? So what you often see first is emotional or behavioral changes. So they may not become more clever but just emotionally in themselves, they become more relaxed. There can be setbacks and there can be aggravations from remedies. Often the body wants to throw things off, often. For example, after a remedy, you might find the child might suddenly get a fever. We're kind of taught to, the conventional way of childhood illnesses is to really get rid of any infection. All infections are seen as the enemy. And that is a great shame because infections are the way the body throws off uh, toxicity um, and viral and bacterial uh, infection, and um, and it also the body the organism needs to use the immune system. It's like a muscle. If you don't use a muscle, then it'll waste away. And the same with the immune system. So if we're just going to put a lid on every infection, that could have negative effects as well. So infections in a homeopath's way of looking at things is not an enemy. In fact it is often to be encouraged. Treatment usually takes months to years. It's not a sort of thing. You may see quick changes, you may see some improvement, but to see maintained and a stable change, you need to give it months, some months, certainly some months, and maybe even more. And Rebecca asks, have I treated an adult who regressed into autism like behavior after getting COVID? Not the jab, the virus. And no, I haven't. So I can't really answer that. Um, Interestingly, the case I presented of the young man before who was taking escitalopram, He continued for some time taking that drug, even while he was on the homeopathic remedies. But at a certain point, he decided to come off it, which was a big thing for him. And he then went into a dip. He sort of went into, and he was also taking cannabis as well. And he went into this sort of very low energy, no low motivation state. Again, a remedy. I gave him a remedy. It was the remedy was arbutus. It was the strawberry tree. It comes from the Erica family, and that cleared that whole picture, and he was back to how he had been before in a positive way. So signs a child is moving in the right direction, more emotional range. I said that he had this young man was very neutral, very in the middle, not really being expressive, but that you sometimes see them becoming more expressive, which is a good thing. Less rigidity, increased curiosity, better sleep, more spontaneous engagement, and a willingness to try new things. Okay. Okay, so um, I wanted to present one more case. And that picture is not, that's a stock photo. It's not a picture of the actual child or the mum. This case is very interesting, and I was very fortunate to be able to interview the mother of this child. She was a 9-year-old girl. I've interviewed her, and you can find that interview on my website. And it's only a short. I mean, it's about 20 minutes long, I think, and it's fascinating because the it was a wow. It was a real roller coaster, and it really showed homeopathy in its best light. So let's have a look at this case. So it is a real case, and but I've sort of simplified things to protect their privacy. So I treated this 9-year-old girl with autism symptoms of PANDAS. She's very bright, very bubbly, articulate, and intelligent. But her life, I mean, I say, had become extremely difficult. I mean, it was hell. Let's call it as it is. It was hell. So this young girl, she was experiencing severe OCD type fears. A constant, she would describe a feeling haunted, a fear of being poisoned. And this had all basically come on, by the way, after the vaccinations. After her childhood vaccinations, this is what happened very, very soon after. Fear of being poisoned. She didn't want to touch her food with her hands. She asked her parents to taste her food, all her food first. Everything she ate had to be tasted first, if you can imagine that. Extreme rituals around dressing and leaving the house. So it would take hours for her to get ready because she had a fear of touching her clothes. Intense. She was very, very clingy. She would follow her mum around. I mean, from room to room, she would be there clinging to her mum. She slept in her parents' bed. Remember, she's 9 years old. You can imagine what that does to a married couple and the sort of family. I mean, it's not desirable. Clinging to her mother for safety. She felt excluded and disliked at school. This is a very sort of common thing with pandas, as I mentioned before. Her parents were exhausted and distressed. It was a 24-hour job. They were doing everything they could, but they were really suffering. So it was like, if we analyze it, it was like she's stuck. She wanted to control every second, basically. She was so fearful that she had this fear in her and she had to try and control everything. So, as I mentioned, a sudden change in behavior due to vaccination, plus the mum had a strep infection during pregnancy. Um, the parents had also had her tested for chronic infections and parasites, and that had proved positive. And in fact, parasites I've found is quite an important aspect of autistic children that is they're quite common. I don't know whether it's I think maybe I mentioned it a little bit later, but it is quite common. So worms we're talking about, that's that sort of thing. Um, she tried to control everything because nothing felt safe, not bad behavior, survival mode. So over time, as I treated her, she began eating with her hands. She could get dressed more normally. And this all happened over a period, I think it was over about 9 months, something like that. She could get dressed more normally. She could leave the house and attend school. She became calmer and less fearful. She didn't cling as much to her mother. And eventually, I mean, that was the most wonderful thing when she said to her mum, she said, "It's okay, mum, I've got this." Oh, that makes me feel quite emotional. Um, that she was able to leave. This was the final step. She was able to leave her parents' bed and sleep by herself. She became more emotionally present. She started eating at school. That was a big thing for her. She became more assertive with her peers. I mean, actually, sometimes she was pushing boys around. I mean, literally, physically, she became very assertive. She also, realized, I think she had a greater sense of being able to look at herself and be able to regulate her emotions and her impulses. She could learn, she could remove herself from stressful situations. She showed growing independence. Her parents described her as more herself, calmer, braver, and more able to cope. And they literally said, the mum said it was like going from hell to heaven. And this child is now, I think, living a normalish life, actually. She's confident at school now. All those fears have kind of regressed completely. And it was really, again, very touching, very important case. So just a few points though. The progress didn't happen overnight. I think it took it was between 9 months and a year again that these happened. But there was a gradual improvement over the whole of that time. Actually, I think at the beginning there was a couple of ups and downs. While I had to find the right remedies for her, and there were a couple of ups and downs. And then once we got the sort of the right remedy, uh, we then things started gradually improving, and until yeah. It comes sometimes in stages. Some symptoms improved early, others took time. New challenges appeared. The Her relationships at school became the focus. The spotlight became more on that actually in the latter stages. The feeling of feeling outside the group, that was something we had to treat. And again, yeah, the remedies really worked on that, and she was able to be much more assertive and to really yeah say what she wanted and deal with those challenges. I mean, being at what kids are like. Kids can be very cruel at school, and for somebody as sensitive as this child, it was even more difficult. So the fact she was able to deal with that was a big change. So that's the sort of end of the main presentation. Um, this is just an invitation. If you do have a neurodivergent child or an adult or a loved one, I do offer a free video chat where you can ask all your questions, talk it through, and see whether it might be a helpful path for you or your family. It's completely free and no obligation. So I will send you an email after this, and you can book yourself in. So the main Okay, so I'm not going to talk about the remedies in the last case because this is mainly for parents, not for homeopaths. But I want to invite you, if you do want to know more, I'm doing a 1 day seminar on this subject on neurodivergence in April, and we will go into great detail into all the remedies. We will look at all the different families and where we can go, and plan A, plan B, plan C. And I'll be presenting these cases in more detail, plus some other cases as well. So that's really where, and there will be a recording of this available as well. So if you're not local, or if you can't get down to Brighton in the UK, or if you live outside the country, there will be a recording of this. So that's what I would encourage you to do, is to sign up for this and and learn more about this fascinating subject. Okay, any more questions? I don't want to talk about, somebody's asked about classical versus modern homeopathy. Um, I, I don't want to talk too much about this. Again, this is really for parents and not for homeopaths. I know you lovely homeopaths all want all the hot details. I tend to use um, classical homeopathy but not exclusively. It depends what's needed. It's what Robert Davidson said is appropriopathy. It's what suits the patient, what is going to get the results, basically, clinically. But I tend to err on a sort of classical side, yes. And I've also embraced the newest developments in homeopathy, which is very important if you really want to seriously treat people with autism and other neurodivergent issues. You really got to have a very wide palette at your fingertips. um, Lizzie has asked if PTSD has elements of neurodivergence. Um, uh, and I don't know. It's an interesting thought. There's one thing I would say is the development of internet, social media, and the how that affects children is quite an interesting thought, because it overstimulates the brain basically, and it can cause like an ADHD type effect. A lot of the autistic kids uh, cling to their tablets and their phones, and sort of are a bit addicted. So that's an interesting aspect. Suzanne asked, "Do I use one remedy at a time?" Um, Normally, but not absolutely exclusively. But normally, it's one remedy at a time. Because I find that's what works best. If you know enough remedies, you can normally get the results using one remedy at a time. But occasionally, there's a need for more. Okay, any more questions before we finish? I haven't used strep tilt, no. I use just streptococcinum, the regular one. Okay, Lizzie says she's had PTSD. Um, well, you're very welcome to book in for a free chat about that if you want to. Do I see a lot of pandas cases? I see a few. Sometimes it's blurred. It's the blur is blurred between autism and pandas. So, okie cookie, I'm gonna go off for a swim now. Um, oh, any side effects? There's no side effects from homeopathy. You wouldn't get side effects, but they can produce aggravations, a temporary aggravation of symptoms, which means that the body is having like a spring clean or throwing things out. So, do you tend to see a lot of plateauing with gains, blocks along the way? um, Once you've kind of got into the groove, once you've got the sort of that first remedy right, things then tend to progress in quite a good way. There are some really difficult cases out there where I haven't been so fortunate. There are some cases that are just tricky, and finding the right remedy is more difficult. And it does depend on a certain amount of commitment, I think, from the parents, People want quick results, but sometimes it takes a couple of goes or a few goes to get the right remedy. Do you think it's maybe vaccine? Vaccines certainly have are the smoking gun in many autism cases, but I would say not all, but certainly, and the parents, are absolutely adamant that the symptoms started immediately, like within a day or two of having the vaccines. And it's not surprising. I mean, the number of vaccines they give now to kids is ridiculous. I mean, they give when I was a lad, we used to have BCG, polio, and smallpox. I think that was it. And now I think they have 70 vaccinations in America, 70 vaccinations between 0 and 18 years. And there's been no research has been done into how those all those vaccinations work together. There's no research at all. So um, charges, you can look on my website. That's the best thing. It's all on there. Okay, guys, I'm going to say goodbye to you, and you will get an email, say with links and if you want, and also an invite if you want a recording, then you can also purchase that as well. I'm really happy to have met you guys and have shared this with you, and I hope you found it useful and maybe a little bit inspiring too. Take care. Bye bye.